When standing on the shoulders of giants, it is important to respect the view from where we stand, but also we must consider the weight of our children whom we will bear. It is easy to look below and overlook the amazing feats that came before us. Knowingly, we are ever in the present, which give us an interesting perspective when looking back. It is invigorating to reflect on our journey as a triumph through time. After all, we have made groundbreaking discoveries that blast us from the past into a constant bliss of achievements. Yet, looking through history, we have always come across findings that defy our past. Notwithstanding, it is important for us to refrain from priding ourselves in having the greatest understanding humans have ever had, because it is too easy to get caught up in the feeling of having it right. Why would we compare ourselves with the past? We need to accept that we have things wrong, and in the name of science we must expose our weaknesses. The objective of the presentation of these ideas is to envision our next move on treating psychological disorders with a focus on schizophrenia. The aim herein is to show the need for abandoning pharmacology as a practice for mental health. Although the argument for this claim will be supported with the most recent scientific research, the structure of delivery will remain of simple logic. Using one of the simplest valid propositional forms, modus tollens, the argument will flow as follows. If a method is successful, it must meet certain criteria. The method does not meet the required criteria, therefore the method is unsuccessful. If treatment for mental illnesses can be deemed successful, it must eradicate the illness and provide lasting virtue on humankind in absence of unwanted consequence. The delivery herein will use schizophrenia as the focus for all mental conditions for two major reasons. Firstly, it is the most chronic and disabling of all major mental disorders, and secondly, it is the costliest condition in the world. Even by proving antipsychotic medications to not be the most successful method for treating schizophrenia, would not necessarily prove that all pharmacological interventions fail. It will, however, show how treatment for the most thought to be drug-dependent psychological disorder can be more successfully treated. So let me discuss the history of treatment for schizophrenia. When we look back to the 5th century BCE, it is quite easy to ridicule bloodletting as rational treatment for schizophrenia. However, just before that time, it was widely accepted that delusions, hallucinations, disorganized speech, and the like were demon manifestations in one's body needing destruction. In this light, Hippocrates provided a new method of treatment based on reason. His reasoning was based on a proposed theory that body and mind relied upon 4 bodily fluids, including blood, phlegm, black bile, and yellow bile, which he called humors. His theory was based on intuition more than anything we would call science in today's world, but this theory he proposed was revolutionary, in the sense it brought a biological explanation for mental health. Without the scrutiny of science, a theory is unable to develop in the way we know it now, but by mere tinkering combined with trial and error, the path for helping a troubled mind began to make way. Not to be forgotten, hundreds of years after Roman and Greek advancement in medical sciences and psychological disorders, came a period known as the Dark Ages, where rational thinking was plunged back from where it came, and demonizing schizophrenia became prevalent again. And there has been speculation on whether the persecution of witches at these times actually had mental disorders or not. But regardless of this trivial fact, the rationale behind actions were at great scientific decline. And gradually, minimal amounts of compassion grew into the eventual recognition that people with mental disorders needed professional help. Now, during the 15th century CE, reforms were made for more humane treatment of people with these disorders, and asylums were used to treat them. The living conditions at this time were far from humane, but it orchestrated a shift in understanding such illnesses. So, let's take a hop and a skip and a jump through time to our present day. Here we are amidst a new age of technology, changing too rapidly to appreciate the brief time it will appear from our successors looking back while upon our shoulders, heisted far beyond from where we now stand. There's only one constant truth that has never led us astray in all scientific pursuit of knowledge. Namely, we improve our methods. Drugs have been proven effective in treating schizophrenia, but it is imperative to ask at what cost. In the 1950s, first-generation drugs were introduced to treat schizophrenia at the cost of muscular and neurological abnormalities, while symptoms of schizophrenia still largely persisted. In the last quarter of a century, second-generation drugs such as clozapine showed promising results, but the most recent studies fail to show vast improvements when it comes to adverse side effects or long-term relapse prevention. Despite the advancements we have made in treating schizophrenia and over the past 50 years, we have failed to eradicate the illness and have often created more problems in our attempts. More importantly, we have not established long-lasting virtue for mental health. In order to reach this virtuous state, we need a holistic approach that focuses on preventing and healing disorders with healthy lifestyles such as diet, exercise, and meditation. Not only do medications often only mask symptoms, they do so at the cost of numerous harmful side effects, such as the disabling effect of tardive dyskinesia from clients taking major tranquilizers. When looking at the mere process of metabolism, is it not necessary that other parts of the body, including the brain, will be affected? Not only must the chemicals circumnavigate the body through the circulatory system and filter through the kidney and liver, but even the brain chemistry is altered in more ways than the one intended from the drug. The very fact that anyone has ever been able to discontinue all medication by changing their diet is enough to spawn serious interest into the relation of healthy living and psychological disorders. Moreover, there has been repeated studies all showing strong evidence that yoga can relieve psychotic delusions and other schizophrenic symptoms. Now, whether or not a holistic approach of healthy living is a panacea for curing all psychological disorders has yet to be established. However, there is ample evidence for the value of research to be aimed in this direction. The fruits of our labor will be able to provide the lasting virtue of successful treatment free of any negative consequence by merely altering habits and diet. Medications have been an intricate part of treating mental health issues for well over a century. Through their use and the research conducted thereof, we have gained an understanding of brain chemistry and neurobiology, inequivalent of any other research. This invaluable knowledge should be cherished as we reap the benefits of the giants who came before us. Even though the data we have is irreplaceable, the methods used when acquiring it are, in fact, wholly replaceable. We're not bound by the ways that have proven most effective for so many years. We stand at a new dawn of time, with the horizon far-reaching from our grasp. Although it might sound risky and an uncharted area of potential discovery, innovative ways at interacting with the brain must be achieved. We should accept medicinal intervention as the necessary step taken in order to achieve the understanding we now have and move on. So, what does our future hold? First, let me reiterate that it is true that diet, exercise, and meditation should be elemental in the healthy lifestyle of anyone battling mental unease of any form. That's necessary for humanity to prosper as we all seek psychological congruence in our lives. Again, this is a larger issue than the one at hand, but it is important to see the greater picture from any place we stand. One may argue, rightfully so, that some people have conditions too severe for a mere change of lifestyle. For instance, some people with the most chronic and debilitating psychological conditions may have been born with genetic abnormalities of brain chemistry, suffer from long-term chemical abuse altering the brain structure, or be at the mercy of a degenerative disease affecting cognitive abilities. Although diet, exercise, and meditation may not be enough to cure such individuals, it is undoubtedly worthy to acknowledge the synergetic effect they will have in combination with any treatment. Let us remember that the objective herein is not to eliminate pharmaceutical intervention without using our scientific superiority gained from the past to advance further, but rather to use every meme of insight we have gained in our scientific pursuit to better serve humanity in long-lasting virtue. It is time to interact directly with the brain. Our quest has provided us with a map of the brain we could not have even imagined at the start of using pharmacology as a means to heal the mind. Through our progress in neuroimaging alone, we have made paramount discoveries of physical localities of the brain which express cognitive dysfunctions. These discoveries call for new therapeutic neuroscience-based treatments in psychology, psychiatry, and psychopathology, and all the future fields that have yet emerged from within these domains. Aside from the financial influence in the political arena and the pharmaceutical companies' strongholds in preserving client-patient dependencies on medicines, we have every reason to move forward from the primitive ways of drugging our illnesses aside and getting closer to interacting directly with the source of mental complications. We have mapped the brain more in the last 5 years than we have ever done, and we will be able to say this for decades to come. This is where our future is when treating mental illnesses. Neurological intervention may not even be the end-all cure we seek, but it is the area of science which will provide us with the knowledge we need to further understand the mysteries of the brain, the mind, and consciousness, by either clearly defining the three or coming up with an all-inclusive definition. Lieberman, a pioneer of social cognitive neuroscience, SCN, experienced the merging of social science and biological science over less than 2 decades ago. In hindsight, he admits it was inevitable, but in the early days it had seemed unimaginable. Awareness of all shifting scientific thoughts remains critical for each domain. If we fail to recognize what this means for treating psychological disorders, we fail to meet our clients where the science is. We fail to provide the most successful treatment methods we have available. In all actuality, the more we learn, the less we must intervene. It may be easy to write off this goal as overzealous optimism, but it must remain our goal, even if it is a limit we cannot reach. Why continue to use a treatment plan that, although can produce effective results, fails to work without tampering other body systems, thus causing unwanted consequences, and doing little for the whole of humanity or our future? It is easy for the unapprised individual to look at SCN with disapproval as reminiscence of early electroconvulsive shock therapy or insulin coma therapy or prefrontal lobotomies because it is missing with the brain, but that could not be farther from what this actually entails. To regard such inhumane and unfounded practice of our past as remotely parallel is simply to be uninformed and not up to date with the times. Again, just like the Hippocrates' ideas of bloodletting is an irrational method of treatment at present, it was based on the idea psychological conditions were biological, which was revolutionarily in the right direction for the time. In the same like, shocking the body or removing parts of the brain with little knowledge to what effect it would have remains unjustified. But the idea of interacting with mental functions by going to the source was and remains justified. In fact, with our constant progress in the fields of neuroscience, neurobiology, and neurology, it has become ever increasingly irrational to continue contaminating the entire body with poisons to create the reaction we desire of brain chemistry, when we in fact have better capabilities in achieving these ends by taking a neurological approach. Such methods have far better implications than a lifetime of ill effects and addictions to pharmaceuticals. In fact, our current capability and ongoing progress in the field makes it a far less intrusive process than one could imagine. With our technological abilities, we can operate with the most nanopoint precision. So let me describe our present abilities. We have repetitive transcranial magnetic stimulation, RTMS, and transcranial direct current stimulation, TDCS. They're both of the most current, non-invasive, rarely contraindicated, with little or no side effects, and fairly easy to use methods of SCN. With RTMS, an electromagnetic coil is applied to specific parts of the brain and given magnetic pulses in those areas, while TDCS involves specialized currents of weak electricity used to stimulate precise areas of the brain. In combination with these methods, therapists can provide cognitive remediation, which entails cognitive functions training and psychosocial care for an integral therapeutic approach. The advances are literally improving in real time, thus further research is in need. Nevertheless, it provides the most promising future for treatment in psychopathology, psychiatry, and holistic therapy. Now, looking back and letting go. When looking back at how far we have come, it is fair to say that we have continuously developed treatment plans that improved on our growing knowledge we have learned thus far. It is time for us to realize the peak effectiveness of which pharmaceutical intervention is capable has been reached. To shift from a pharmacological model to one of neuroscience is simply for the times. Our endeavors or persistence, our feats have not been in vain. The time, money, and effort given to developing psychopharmacology has achieved efficacious results and provided us with better understanding of the human body, neurotransmitters, and brain function. We are not abandoning the science that brought us this far, or the scientists who dedicated their lives to the cause, or the patrons invested within. We are simply ready to promote a more successful treatment plan for psychological disorders. We must help troubled minds without imposing troubles in any other form. We also must provide a society which embraces healthy lifestyles as part of healthcare. Not all is lost for prescribed medication in treating psychological disorders. In fact, they may always have a place in research for understanding more about the brain and its relation to psychology. For instance, once we are able to map the functional activation of the whole brain as done in mice, pharmacological intervention can still prove beneficial in determining whether certain regions of the brain are strictly necessary for specific functions, such as the expression of a behavior. So, in conclusion, we must both have an aim and means to achieve it. In psychopathology, psychology, and all relative sciences, it is imperative we improve our understanding, our methods, and humanity at large. We must find improvements in our ways when able, or we must find new means to achieve our mark. Nothing short of absolute perfection should be our ultimate goal. Even if this is a mathematical limit that cannot be reached, our ever-nearing progression should be the necessary force behind our pursuit. This presentation aimed at demonstrating the ultimately inadequate approach of pharmacology in providing the best treatment for psychological disorders, while focusing on schizophrenia, which many may argue requires pharmaceutical intervention. The idea is not to undermine pharmacology as a pillar of knowledge that has and always will be an important component in unlocking the mysteries of our mind in relation to brain chemistry and functions, nor is it to forbid the practice of medicine and psychiatry, therapy, or any related field. The purpose remains simply to recognize the shortcoming drugs have in the bigger picture. It is with dire need to never disregard a practice that has unarguably provided remedy for most of the last century, without providing an alternative to provide what would be lost. The area of neuroscience as described in this presentation provides a more successful means of treating clients with psychological disorders. Although this proves monumental in psychiatry, the implications on therapy are less. In fact, it could easily be argued that drugs have altered the holistic approach needed to reach clients. Psychoeducation and family therapy of clients diagnosed with schizophrenia often focused on the side effects of psychoactive drugs, the stigmatization, and resources to receive medication. By diminishing the use of drugs, therapists will be better able to focus on the tried and true practices of humanistic counseling theories. For this reason, it has been central to recognize the importance of a healthy lifestyle. Our advances in neuroscience do not assure trial without error, neurological treatment without dependencies, or intervention without contraindication. We have yet to demonstrate perfection in these areas. Although our goal will be to reach such state, even with the shift from pharmaceutical intervention to neurological intervention, we must continue our pursuit. It is true that diets, exercise, and meditation have not, and probably never will be, wholly proven sufficient to cure all illnesses, but the marrying of healthy lifestyle and psychological treatment is fully warranted, This should be integrated into every therapeutic approach, as well as any pharmacological or neurological intervention. Certainly, a healthy lifestyle for the body is as for the mind. Until we have proven any separation of the two, we can only assume this is a tautology in the highest regard.